Hello, everyone. I hope that wherever you are, you're safe and well. My name is Marilyn Zahour. I'm the CEO and founder of Cosmic Centaurs, and we're a leadership and organizational development firm. Today, you're joining us for a session in the third and final week of our 7th annual Cosmic Conference. While this conference is usually held in October, the pace and gravity of events across the region made it clear to us that this conversation couldn't wait. To support leaders when they need it most, we chose to bring this year's edition forward and convene this conversation now. Our conference is titled Grounded and Limitless, Leading Organizations That Survive and Thrive. And through it, we're hoping to support leaders as they managed prolonged uncertainty. At the core, this idea of being both grounded and limitless is about staying clear-eyed about reality, but continuing to build what's possible. And to explore this together, we've brought more than 15 leaders, experts, and academics to make sense of what leadership requires in moments like these across 3 themes. Week 1 was about enduring, how we survive periods of uncertainty. Week 2 was about adapting, how we evolve in response to change. And week 3, thrive, is how we turn these lessons in crisis into a competitive advantage, emerging stronger, more innovative, and better prepared for the future. You are tuning into a session from week 3, where we explore how organizations translate the lessons of crisis into lasting strength. If you find value in this session and want to give back, we ask that you take our survey. We're conducting research to capture how leaders in our region are navigating uncertainty as part of a broader initiative to codify and document what leaders from the Arab world can teach the rest of the world. You'll find the link in the comments section to our Leadership in the Arab World survey. If you have 5 minutes to spare, it would mean the world to us. Now, to today's session, Pressure and Performance, How Crisis Makes Organizations Stronger. I'm very pleased to welcome Dr. Saleh Al-Tamimi today with me. Thank you for joining us.
Thank you for having me.
I'll start by introducing you, and then we can get into our conversation. Dr. Al-Tamimi is a pediatrics emergency medicine consultant and national healthcare leader. He's ranked 28th on the 2025 Forbes Top Healthcare Executives in the Middle East. He's worked as an executive leader in both public and private Saudi health system, and he's currently the CEO of Riyadh First Health Cluster, a large health system including King Saud Medical City, 17 community hospitals, and 160 primary care centers with a total of 4,000 beds, 28,000 employees, and an annual operating budget of 8.5 billion SAR, leading the health transformation at R1 to achieve Vision 2030. Now, before we dive into our conversation, I just want to ground it a little bit in the context that you and R1 and the rest of the health community have been operating in. Because Saudi Arabia, of course, is undergoing one of the most ambitious healthcare transformation globally, shifting from a system where the Ministry of Health was both provider and regulator to one where care is delivered through accountable care organizations. And these clusters are responsible for the health of entire groups of populations, operating with capitated budgets where the focus shifts from volume to outcomes, from treating illness to managing health. And this fundamentally changes how organizations operate. It changes incentives, decision-making, and what leadership looks like at every level. And layered on top of that, of course, you were leading this cluster through an acute crisis of COVID-19, where the system was truly stretched to its limits. And crises like that don't just test systems, it teaches them. It reveals what's working, what's not, and what the real pressure points are. And the real leadership challenge is, how do you take what you learn in those moments and bring it into the core of how the system operates and transform it into a competitive advantage? And that's what we're going to explore together today. So I'm going to jump in with my first question, and we'll take it from there. Of course, as I just mentioned, you've been leading the R1 cluster through both national transformation as well as acute crisis. I'd love for you to share with us what lessons you learned from these 2 different kinds of crises or shocks or transformations. In which ways were they similar, and in which ways were they different?
Well, thank you first for having me. I think the COVID-19 shock was more intense and concentrated on testing the capacity of the system. and the endurance of the healthcare practitioners, because it basically threatened everything. Not only that it tested the system, it tested the spirituality of the healthcare practitioners and the managers, because they were risking their lives every day to save others. Like, imagine every day you are working in a ward or an intensive care unit where all the patients have the virus, and this virus could easily pass to you. And especially the time before the vaccination. So the COVID-19 is probably the most intense test to us as individuals, as practitioners, as leaders, and to the system. The transformation is more of a joy, honestly. It is a very ambitious dream, which we are part of, is to improve our national health system, make it more efficient, and we had a lot of time to do it. Yes.
Yeah, absolutely. And I remember you sharing with me that during the COVID crisis, the cluster that you were overseeing had to absorb 30 to 40% of critical cases in Riyadh. And that's like a really big strain to the system. What did that reveal about what you as an organization were doing well and what you had to learn?
Well, sometimes you underestimate your abilities until you are tested. All right. When you live the moment, and at that time, you have to let go of your fear. All right, and just deal with it. Sometimes good things happen, and things that will surprise everyone, surprise us. And this is exactly what happened, is that we were able to take whatever is thrown at us. That time, people were getting sick a lot, and we are known for being a big emergency healthcare system. We have probably the biggest inner city hospital, which is King Saud Medical City. So we managed to double the number of intensive care beds, literally double. We went even a little bit more. We went from like 120 to 250. All right. We created intensive care beds everywhere. We trained doctors and nurses who never worked in the ICU. We trained them and we deployed them in the ICU to take care of lesser sick patients, so that the core team can focus on the very sick. Reflecting on all this, made me learn that our abilities, we don't know exactly our abilities until we are tested. All right. But of course, this doesn't mean that you don't work on it, you don't train yourself, prepare the system, all that. Those are all important. And those were things that we did. We have been doing for a long time, and that really helped us during the crisis.
Yes, I think that's really beautiful. I think you have to prepare, but you'll never really know what you're ready for until it happens. And it's really inspiring, actually, to see that the ability to double capacity in a hospital, I can't imagine is something that we would ever see in normal times. And the ability to both have this certainty, as you said, it's almost spiritual to say we are here to fulfill this purpose and we will do it no matter what, including sometimes at great personal cost to the individuals who were serving others. So putting in so much alignment and trust, and at the same time developing agility, training people on the go, figuring out new locations for ICU beds. These are really incredible outcomes, and we really only see them when the system is put under pressure. And that's actually, you know, the point of this week, and what we were hoping to teach leaders is that we are going through a really difficult crisis, and many organizations are, you know, facing an existential moment. But if we do manage to come through it, and if we actually take the lessons from this very tough period, then we can come out being more high performing, more innovative, and do things that we never thought were possible. You know, an example that I always love to share is the example of Fujifilm. I think I shared it with you the other day, which is, of course, a company that we all know as a camera and a film company. And when it was disrupted by a market shift, managed to actually reallocate its capabilities to invest in areas like healthcare, and really reinvented themselves. I really think that crisis, if we survive it, of course, you know, we say what doesn't kill you makes you stronger, really allows us to innovate. What do you think on the long run, now a few years later, how has your organization become stronger as a result of that period? And how has it kept its agility over time?
Well, it was like a crash course in that lasted about 2 years, that taught us how to scale in the worst setting. All right, and that really built muscles, all right, for the system, and the unity or and the bonding between the staff became much stronger than any time before. We lost 5 of our practitioners during the COVID, and the system, the 28,000 employees, grieved every one of them. All right, so they grieved together, they celebrated together at the end of the COVID. They had a common purpose, coming every day to work to save more people. And imagine that the risk they pose to themselves and to their loved ones. Many of them are mothers and fathers, and I remember very well that many of them actually isolated themselves for months from their kids and spouses. Some rented a place out of their homes. Some lived in a separate room. And imagine what happens after 2 years of doing that. You come out much stronger, all right? And you really become more attached to your team, to your organization. You believe in yourself. So a lot of things really happened that made us stronger during this journey of transformation.
Yes, and also you shared with me, I mean, first of all, Allah yarhamhum, I'm sorry you lost them, and you know, it's a wonderful thing that they did so in the line of duty, very inspiring to all of us. And as you say, like, this kind of human experience makes us stronger, believe in each other more, believe in our system more. You also learned from this experience to be agile and to look for innovation and to scale, as you said, new ways of serving your people and your citizens. And you shared 2 more recent initiatives with me that I thought were really beautiful. One is your outreach programs to remote areas, And the second is your AI startup partnership. I wonder if you could talk to us a little bit about those, because they're really great examples of how you maintained agility as an organization, even beyond just the cluster, also collaborating with external stakeholders and partners.
I think whether in the healthcare industry or any other industry, leaders are now more than any time before have to do more with less. The luxury of having enough resources it will be the exception, not the norm. Now, for us in the healthcare transformation, the ultimate goal in Saudi is to bring the expected life expectancy to 80. All right, we are now around 79, and this means that we have to work on prevention more than any time before. Work on early diagnosis of chronic diseases, particularly, and prevent their complications, and work on the mental and the social side of health also, not just the physical. And from that thinking came a number of initiatives. Two of them were the ones I mentioned to you yesterday, is that we worked with the Ministry of Human Resources and Social Development, and we've identified all the Saudi citizens on social assistance that live within our coverage area, and approached them, went to them in their homes, enrolled them in our healthcare program through the local primary care center, assigned a family physician to each one of them because they have higher risk of dying early compared to others. And now we have at least 20,000 of them enrolled in our primary care centers on a regular basis. And this is something that we never did before. In the past, we are more of a reactive system. So we care for whoever comes through our doors. Now we are more proactive, and we go out to help people wherever they are. The second project was the outreach program, where we send a big group of consultants, doctors, and nurses to spend a day or two in the little towns around Riyadh, where they see a big group of the folks there, do their screening, check on their health, and sometimes the ones that need will be booked for follow-up in Riyadh City at our hub.
Yeah, I think those were really beautiful examples. You also shared an example of a collaboration with a startup, which is quite unusual for public sector organizations, especially at your scale. Could you tell us a little bit more about that?
Yes. AI is applications in healthcare are growing very fast. And we, as a big health system, we felt that we shouldn't be only a consumer of healthcare technology, but also a developer, through our R&D arm. We partnered with a small company called Saleh AI from the UK, who now they have an office here, and they specialize in ambient AI or note-taking scribes, AI scribes, which basically records the conversation between the doctor and the patient in Arabic, all right, and turn it into a professional medical report in English, and also does the coding and all that. So it's something I also use in my clinic for the last year and a half, and I don't think that there is a way back to me entering my history on the keyboard and physical and orders. That's going to be history. The technology is so good that it will do all this for you, and even more, it will help you make the right decision through the decision supports. Will take care of the billing with the insurance company, etc.
I think it's really incredible to see AI being used this way. In week 1, we had a session with Dr. Connie Hadley from Boston University, who actually studies how AI is increasing loneliness at work. Of course, it's always easy to look at the doomsday scenarios, or it's important that we manage the downside of AI, but to see the upside of AI, of actually maybe even allowing a doctor to be more present, to engage instead of typing. I always get a little bit upset when my doctor he has to or she has to, it's their job, and they're doing good record keeping, but when they're looking at the screen instead of talking to me. So I think that what you're talking about is a really nice example of removing the administrative tasks to allow doctors to go back to being caregivers and not not have all this paperwork be sitting between them and their patient. I think that's a really beautiful initiative. And reflecting on a lot of what you shared, I really love this idea of, like, you start with a clear goal, which is to provide holistic care, to provide it to more and more people, to raise the average expectancy, which I think we should mention is higher than the global average. So it's already in a really, really great place. And then we don't stop at how we do it. We're open to exploring everything from outreach programs to collaborating with other entities, which is never an easy thing, I'm sure, to also going in partnership with the private sector. So it really comes to show this willingness to explore all possible solutions that align with that goal. And another thing that you and I spoke about that I thought was really striking is the relationship between efficiency and innovation. Most organizations think of efficiency and innovation as competing priorities. One is about control and the other is about exploration. But what you shared with me, and of course the research also agrees with that, is that the best organizations are able to be ambidextrous, meaning they're both able to exploit the current business capabilities for efficiency and profit, but also explore new technologies and new ways of delivering value. I wonder if you could speak to us, because you said this to me and I said, great, we have to spend time on this, because it's quite rare for someone to say it like that. But actually, in your view, efficiency and innovation don't compete, they actually support one another. Can you talk to me about your perspective on this?
Of course. I mean, I can't see how efficiency and innovation compete. Innovation complements efficiency. I mean, if you keep repeating the same way, you will get the same results. And I think this is something that many would agree with me. Now, for us, for example, let's take telemedicine. All right, as a new innovation, and how it made the healthcare system more efficient. So let me, zoom in on what this is in our system. We get patients from all over the kingdom. Okay, so a patient living up north will have to fly to Riyadh to see his doctor. All right, for an appointment, for like a 20-minute appointment. All right, and then fly back to his town. Now he doesn't need to do that. All right, like look at the efficiency in this, and so on and so forth. I think innovation is the biggest levers and tools for maximizing efficiency, and the healthcare system is a great example of that.
Yes, absolutely. I think that maybe one of the things that people get wrong about the relationship between innovation and efficiency is that they create the efficiency, they manage to get the dollar savings, but then they don't reinvest them. And so they find them to be in opposition to each other because they're only worried about shareholder value and paying out dividends and so on, rather than figuring out how to create this virtuous cycle with a long-term perspective that overall the efficiency will be even bigger as long as we continue investing in new innovations. And one of the examples that you gave me was about the new insurance model, or the new kind of capitated model that's going to either has already or is going to come into play for the Saudi healthcare system. This was a really interesting example to me because it really shows a system at scale that is combining efficiency and innovation. Can you explain to us how that will work?
Yes. So the Center for National Health Insurance will represent the payer in buying healthcare services from the health holding company and its 20 health clusters, or it's synonymous with trusts in the UK. All right, so basically 20 health systems. We are one of them. The new, in the past, we have always the funding for the national health system was line item block budget. Okay, and now, which the old system used to incentivize spending every penny and asking for more. All right, because if you don't spend the money that you get this year, you will get less next year. So the incentive was to spend everything and ask for more. Now it's going to change to a capitated model where the Center for National Health Insurance will pay us per capita premium on the number of citizens that our beneficiaries, with the incentive to that we keep any savings we make if we meet all the targets. Okay, so if we meet all the targets between us and the contract between us and the payer, whatever money we make at the end of the year, we reinvest in the system. So you can imagine what the behavior of the health clusters, how the behavior of the health cluster will be in this with this funding model. Basically, it will maximize efficiency because the national health system is always the stigma, or the common opinion is that it is not efficient. There's a lot of waste compared to the private, because the government is generous, all right, in supporting the national health system. So there's a lot of waste. Now the government understands that this has to change to become more efficient as part of Vision 2030, and the best funding system after studying the world is the capitated model.
Yeah, I think that's really wonderful, and it really shows examples of how to combine human centricity. So you still have targets that serve your citizens and your beneficiaries. So we will not sacrifice the health of our community, but also to push individuals and organizations to innovate in order to be able to serve the same outcomes at a lesser fee, with the condition that they reinvest them in renewal, right? And I think there's a really great academic work from a professor called Gary Hamel. He talks about the challenges that organizations face in building resilience, and one of them is called the ideological challenge, which is that optimization isn't about focusing on a business model or a way of serving that is becoming irrelevant, but it's about renewal. And I think this model is a very interesting representation of how to try to bring something like that at a massive scale, because we're talking about tens of thousands of employees and hundreds and millions of beneficiaries that will be impacted by this. I think that's really incredible. And speaking of the fact that actually when we want to lead thriving systems, one aspect, of course, and we've spent the first part of this session talking about it, is how do you get the organizations, the systems, the processes to evolve? But of course, the system is not a system. It's human beings that are transforming it. The system doesn't transform on its own. And one of the things that you and I have spoken over the few times that we met and prepared for this is really, in addition to the strategy side and the agility and the innovation, the importance of managing the human side of the system, both the organization and yourself. And I want to lead us into that conversation. You've been leading this cluster for I think 8 years now. You've gone through crises and through transformation, and have gone through ups and downs. How do you, as a leader, manage the emotional and psychological reality of change in crises at this scale? And what are some of the main things that you did, or that you and your leadership team did, that you think really help to support that oneness and the trust and the alignment that your employees have?
The key word is engagement, respect. The key words are engagement, respect, empowerment. When becoming very close to the people in the front line is extremely important. Your employees need to see you. All right. So in our case, we are 28,000 employees. I can't just sit in my headquarters here and think that I will get the loyalty and the trust of the 28,000. You have to go. So on weekly basis, I have to visit one of our facilities, and there's always a routine for the program is that I meet with the hospital management, then with the physician group, and the nursing group, and then everybody. All right. So and there they have to see me. I talk about the important things. I talk about what I want their help with, and I say, we need your help to do A, B, and C. We have to do it together. This is not something that a small group can do. Without your help, this is not gonna work. And I explain why. So here I'm pleading for their support, their help. I'm not saying this is what I expect from you. If you don't do that, you'll be in trouble. All right. No. And it's because everyone is playing in his mind. Is this guy real? Is he somebody who has my interest at heart? All right. Or he just cares about work. All right. So going around and meeting people really helped me personally a lot. All right. The other thing which I do, and I know it takes time, and some of my counterparts, my peers in other places say, this is somebody else should do that. But what I do is that any employee who requests to meet me, I have to meet him. All right. I don't say go and meet your boss, your first line of management first. I may ask him, I say, did you meet him? And if he says no, I say, okay, why don't you meet him first? And if that doesn't work, come and meet me. All right. But I have to meet them. And I know I have to dedicate like maybe at least, like it would take 1 day a week. All right. But there's no filtering. All right. Anybody that wants to meet me, anybody that sends me a WhatsApp note, I have to answer. And I tell the leaders on the ground, like the hospital directors, and so I say, if your employee approach me, to me, it means it's my turn. Okay, it's my turn. It means that he has already tried with you and it did not work. So what happened then is that the hospital directors and the managers on the ground became better at meeting their employees, because they say, oh, well, if I don't meet him and solve his problem, I'll get a call from Saleh. Okay, and that won't be nice. And this really helped me a lot. And at the end, what happened is loyalty. You get the full power of the 28,000.
Yeah, absolutely. I really love that, and I have to say, like across whether it's case studies that I know of through my research, or it's individuals that I know. Another one of our speakers this week is Loic Moutot. He's the global CEO of the pet care division at Mars. And you today, like these practices of being present, of going back actually to the fundamental human experience, of showing your face, of being at the front line, those become the lifeline of the organization. And I love what you said. They allow you to access the power of 28,000 people. And that's how systems change, when each one of those individuals do their part. I think that's really beautiful. And of course, every individual needs to do their part, and that includes you, right? Because we often forget. We look at leaders and we see them as strong figures. We see them as guides. We expect them to have human superpowers, and forget sometimes that they're just another human like us. And I think that when you're leading at any level, but especially at this level, you have to develop your own ability to lead yourself through it, because you also experience fear, anger. You're tired, I'm sure, of the number of decisions and interactions that you make every day. Tell us about how you do that for yourself. How do you stay grounded and regulated so that you can be a good leader?
I think this is really, really an important topic, especially in this day and age. Many leaders feel that they are putting up fires every day. And it seems that this is how it's going to be for a long time, where you're always on your toes. So becoming a leader is becoming more and more stressful, honestly. And unless you realize this and you program your brain and soul that this is my job, and I have to prepare for it psychologically, that there will be setbacks, and there will be success. So the mix is always there, and I have to be strong in both of them. All right, but appreciating that there will be failure. All right, and it's just part of your work as a leader, being responsible for a lot of things, and you try your best that there will be more success than failure. Now, so first is that you don't get hit bad every time a setback happens. Okay, you have to be resilient, you have to understand, you have to have thick skin, and reflect on previous experiences, all right, of setbacks and failures. If your organization is generally doing well, all right, you're fine. If the organization is not doing well, you're not fine, and you have a problem which you need to deal with. But if the normal is that a majority of success on a much smaller percentage of failure, but that failure is not going to go away. You'll never have zero failure, all right, or zero setback. So that's one. Number two is that you have to protect the other you, all right? So your family life, your friends, the time where you rewind every evening, weekends have to be special, and you try your best not to take work to the other life, which is your private life, personal life, because that's going to re-energize you. It's going to do the detox that you need so that you can perform well. The problem is many times we lose control over that, and you find yourself working day and night. And to me, that's not healthy. I know you cannot completely eliminate it, but it has to be really kept to a minimum.
Yeah, I really love that. In our first week, we had a workshop with a friend and a facilitator called Daniel Delati. And one of the exercises that he made us do, which he taught me a few months ago and has really been life-changing for me, is to list all of the roles that we play in our lives. So of course, yes, we are leaders, but we are also, I'm a daughter, I'm a mother, I'm a wife, I'm a friend. For those of us who are spiritual, I'm a worshiper. I also have a role to play towards myself. And every week, I set one intention for that role. And it can be like really, really small things, like remember to call my mother and speak to her for more than 5 minutes, Mm-hmm. But this ability to just say, I have to, to protect all of these roles because I am the sum of them. And it's very easy to get dragged into working, 16 hours a day, every day. And I do that. But having this small list and setting this intention of saying, I want to show up in all of these roles in ways that feel important to me, and following through on it and coming to the end of the week and saying, I did call my mother. I did spend a full day with my daughter without looking at my phone. I did remember to check in on this one friend that I haven't spoken to in a while, has created a lot of inner peace for me. So I really love what you mentioned there around your other you and making sure that you take care of all of those versions of yourself that matter. Maybe
yes, I just want to add, Marilyn, one more thing on that is leaders are at very, very high risk for burnout, mental health problems.
Sure.
Okay, and it all depends on how you manage your life, how you vent, how you have your own time to rejuvenate. Burnout is something that happens during a long period. It's not something that happens within because there's a problem this week. No, it creeps gradually until it hits you really hard. And I have seen this once or twice before with some senior colleagues. They were very hard workers. And then there was a time with the last stroke where they cannot continue and they had to stop.
Yeah.
All right, at the peak of their career.
Yeah, absolutely. Sadly, I've also seen that in very senior leaders. And I hope that this is a gentle reminder to any leader listening to us today to make sure to take care of themselves, because we need them to serve for longer. And for that, we need them to be healthy. Maybe one last question. So we have a lightning round in just a minute where I have like 4 questions that we ask every speaker. But before that, I have one last question for you to close this off, which is maybe what is something that you learned about yourself in the last 8 years of being the CEO of this cluster that has been transformational for you as a leader?
Well, there's a lot, honestly, but I realize with time that my biggest asset is the people that work around me, all right, and for me. And I have to take care of them personally and make them understand this. And ultimately build a system that could work without my daily intervention.
That's beautiful. Thank you for that. Absolutely. I think a big part of leading at this level is actually downloading your algorithm into the system and then watching the system be able to make good decisions, to prioritize the right things, and to continue operating whether or not you're in the room. And that's the greatest legacy that we can leave, is to turn our individual knowledge into institutional knowledge. Thank you for sharing that. And of course, taking care of the people around us, because people are always, no matter what kind of organization we run, even if the assets on the balance sheet are all buildings and plants, the biggest asset is always human. So thank you for that reminder. Dr. Saleh, we're coming to the end of our time today. We always have a lightning round at the end of our conference sessions where we ask every one of our speakers the same 4 questions. So if you're okay with that, I'm gonna take you through them. The first thing is, what keeps you grounded?
My family.
Absolutely. My daughter definitely reminds me that I'm not a very important person. Very. And what helps you to be limitless, to keep possibility, imagination, and curiosity alive?
Every time, and I keep saying this to the people that I work with, is to always ask yourself, what else? All right. Are there any other options? So this is like a question at the end of every project or idea or attempt to solve a problem. Many of us think that we only have one choice. Okay, or when the team come, they present something, and I say, all right, what else? Are there other ways of doing it? And this way you release yourself and think always outside the box. All right. And so I always tell my colleagues, I say, come with more, don't come to me with one solution.
Yeah.
come to me always saying, this is the top solution. And then we have number 2, number 3.
Absolutely. I mean, I couldn't agree more. I spend my time talking to people about that because I'm a decision-making geek. So I like to study good decision-making processes. And one of the first misconceptions that people have is that a decision is about saying yes or no to something, but a good decision is actually about choosing between different alternatives, because each alternative can teach you something and improve the overall outcome. So 200% echo that sentiment. The third one is, what is a leadership quality from leaders here in the Arab world that the rest of the world can learn from?
Well, I think honestly, we are becoming one nation. Okay, the people of the world, or the citizens of the world, with all the connectivity we have now, we are becoming similar in many things, in how we think, how we work, and that's really a good thing. But if there's one thing that we could teach as Arab leaders, is the spirituality side, all right, and the relationship between work and religion. And this talks about the purpose in life. So why are you doing what you're doing? Is it only just because of a job and to make a living, or it's beyond that? Okay, it's a mission, it's a purpose, all right, that you consider it part of your worship to God.
Yes, I think
the
that's
spirituality side is really, really powerful, because one says every day, I dedicate all my good work to God.
yes.
Okay, and I pray for his blessing. All right, so when I'm helping people in my line of work, God will help me, will protect my family, all right, etc. And this is a endless source of energy. Sometimes we feel that we're losing energy. We have our tanks are low, but to me, this strong purpose, the spirituality, will re-energize me every day.
I think that's absolutely beautiful. And it is my lived experience too. Thank you for sharing that. And my last question, based on everything we talked about today and what that inspires for you, what are 3 things that you would advise leaders to do today in this time of uncertainty in order to make sure that they continue to innovate and grow their impact and not simply shrink in the face of uncertainty?
Well, number 1 is accept failure, learn from failure. Okay. Number 2 is appreciate that all leaders around the world are under stress, all right, no matter what their job or business line is, and it's part of the job, all right, and you have just to learn coping skills with stress, but this is not going to go away. All right, and make sure that you have ways of steaming, of releasing that steam, so that you could keep going. Number 3 is believe in the people you that work for you, empower them, build a system that does not rely on you. I know that sometimes this may be threatening to some leaders, because they want the board to feel that they are this system cannot work without me or so. But from my experience, actually, you are more valued if you build a system that could function without your daily intervention or micromanagement, a system that will continue even after you leave.
Yes.
So it will be your legacy.
Yeah, your legacy and your amana also. Nothing is yours, you will return it. Thank you for that. What a beautiful response and great advice to leaders anywhere. Thank you, Dr. Saleh, for so generously sharing your insights and your experience and your reflections with us. We're very, very grateful for that.
Thank you for having me, and I really enjoyed the conversation.
Likewise. And to those listening to us, of course, this session will remain available. You can rewatch it. It'll be on YouTube and as a podcast. If there's someone in your network that might find this conversation useful, please pass it along. We are grateful that you tuned in. And if we could ask you for one more thing, as I mentioned earlier, we are trying to do research on leadership in the Arab world. As Dr. Saleh said, of course, there's many things that are universal, but there's also a lot of gifts here of leadership traits that we think the rest of the world can learn from, whether it's spirituality, community, care for the future, or what is on your mind. So please take our survey. We'll put it in the comments. We'd love to be able to publish research about leading in the Arab world. We'll continue these conversations until April 17, and we hope you join us for our next session. Thank you for tuning in, and see you soon.